Come in.
Hello.
Hello.
I'm Chris. I'm going to be your nurse today.
Hi.
What brought you in to see us?
Oh, I fell off my bike yesterday and I really hurt myself.
Okay. Well, before we get started, I'm just going to explain to you a little bit about what we're going to do. I'm going to do a head-to-toe assessment on you, and then after that, we're going to do a focused neuro exam just to make sure you don't have any side effects from that bump on your head up there.
Okay.
All right. So before we get started, just going to check the room and remove this hazardous material you still have stuck on you here.
Oh, okay.
So I'll try and be real gentle. Okay. All right. And can I see your wristband real quick? And can you tell me your full name?
Rockin' Robin.
Rockin' Robin. That's quite the awesome name you got there.
I'm rockin'.
Rockin', can you tell me where you are?
I'm at the doctor's office.
Okay. And what day of the week is it?
Monday? I think it's Monday. Monday.
Okay. And what is my job?
You're a nurse.
Okay.
You're going to take care of me.
I sure am. Tell me a little bit more about your pain.
My neck is stiff and sore. I've got a really bad headache that won't go away, and like the pain sort of goes from my neck down into my arm a little bit.
Okay.
So it's just really sore. My head and my neck are really sore.
All right. I do have your vital signs here, and just wanted to go over those with you. All those blood pressure, heart rate, pulses, oxygen saturation, they all looked good. Okay. I'm going to start your head to toe assessment now. Before we do, I'm going to tell you 3 words, and I just want you to repeat those words to me, okay?
Okay.
All right. Brick, car, shovel.
Brick, car, shovel.
Great, thank you. All right, we're going to start the head to toe assessment, and I'm just going to take a look at your skin first. And since this is your effective side, let me see. Over here will be a little more comfortable. Skin is warm and dry. Colors evenly distributed. So looking good there. And I'm just going to check your skin turgor quickly. Great. Good. And I'm going to check your scalp and just see if there's any lesions or anything on there. Again, if anything hurts from your neck, let me know. Have you had any dryness or any soreness on your scalp as of late?
No, just from when I hit my head yesterday.
Okay.
It's just I have a headache and my forehead hurts a little. It's a little.
Any pain or anything associated with your ears as of late?
No.
Great.
No.
I have to shine the light in your eye for just 1 minute, so sorry for the discomfort. Just look straight ahead. Pupillary reflex is sluggish, otherwise pupils are round and reactive still. Corneal light reflex is normal. And can you open up for me and say ah?
Oh.
Okay. And can you push your tongue to either side? Great. And I know your neck is stiff, so can you move it at all to either side, or if it hurts, don't do it?
It's really sore. It's really tight. It's hard to move.
Okay.
Hurts to move.
All right. And then how's the range of motion in your shoulders? Can you lift your arms up?
I mean, this one feels okay, but this one, no.
Okay.
I don't think I can lift that.
Don't worry about that side. How far can you raise that one up?
All the way.
Perfect. I'm going to check your pulse. Great. Pulse is equal bilaterally and was 60 per minute, so you are looking good. Check your capillary refill. Great, it's less than 3 seconds, that's going good. Can you give me a squeeze on both my fingers as hard as you can? Patient's grip on left extremity is greater than the right. Alright. Can you drag your left heel up your right shin?
Oh, I did it the wrong way.
That's fine.
Okay.
And the opposite side? Great. Check your capillary fill on your lower extremity. Good. Less than 3 seconds. And check the pedal pulse. Great. Alright, I'm going to take a listen to your heart now. Heart rate at Erb's point is within normal limits at 70, so looking good. Now I'm going to take a listen to your lungs.
Okay.
I'm going to start anterior, or on your front side here, go around back, and then your sides.
Okay.
Okay.
Oh, I feel a little dizzy.
Okay. Let me take a break for 1 sec. We'll start with the left actually first. Can you lift this one up just a little bit? Perfect. Great. And just keep that still. Great. Okay, and I'm going to check your fingers one more time. Just want to check for any clubbing. Do you smoke?
No.
Great, that's good. Looking good. And I'm going to ask you to breathe in for me. Great. Chest expansion is within normal limits. Alright, Rockin', now that we have you laying down, I'm going to do an abdominal assessment on you.
Okay.
And first, I'm going to take a peek at your stomach and check for symmetry. And appears to be a bulge in your stomach, and that doesn't look like part of your anatomy. Is there something under your shirt?
I don't know. I haven't taken a shower since yesterday.
Okay, is it alright if I take a peek?
Sure.
And we have a bike seat.
That's where that went.
So, you probably don't want that there and on your bike, so I'm going to put that over there by your frame.
Okay.
Right, I'm going to take a listen and palpate for any other masses or anything. But before that, just a couple of questions. Do you remember when your last bowel movement was?
This morning.
This morning? Okay, and can you describe that for me? Like
I
color, shape, was it hard or soft?
feel like it was soft, you know, like just soft and brown. Pretty normal looking.
Okay,
Nothing to report.
and that's typical for you on a regular day?
Yeah.
All right. And when was the last time you urinated?
Just before I came into the exam room.
Okay. And same thing, can you describe it a little? Tell me the color. Did it have any particular odor?
Well, I like to drink a lot of water, so it was pretty light yellow, and I didn't really smell anything, so I don't think there was an odor.
Okay. And is that normal for you on a day-to-day basis?
Yeah.
Okay. And when was your last period?
I think it was about 2 weeks ago, give or take a couple of days.
Okay, great. All right, I'm going to take a listen now. And while we're going through, if there's any parts that are tender or sensitive, just let me know and I'll make sure and steer around that.
Okay.
Great. You have active bowel sounds in all 4 quadrants. And I'm going to take a quick listen to your abdominal aorta.
Are they rockin'?
They are rocking, Robin. Near any adventitious sounds around your aorta. So I'm going to palpate the 4 quadrants again. And again, if you feel any pain, please let me know. Alright, I'm going to palpate a little bit deeper now, so feel a little bit more pressure. Okay, I didn't see any signs of distension or irregular masses. So now we're going to move on to the focus neuro assessment. All right, Rocken, we're going to start the focus neuro assessment now. So can you repeat those 3 words I mentioned to you earlier?
Brick, shovel, and rake.
Okay. Patient's memory test was 2 out of 3. And could you explain what the phrase kill 2 birds with 1 stone means for me?
I think it means you can do 2 things at the same time.
Okay, great. All right. And can you read those top 2 numbers for me?
9, 5.
Great. All right, I'm going to put both my hands out here and move them back towards you. When you can't see them anymore, please let me know.
Okay. Okay, can't see anymore.
Okay. Peripheral vision is intact. All right, and again, look at the top black cap on my pen light. Great. No extraocular eye movement is noticed. All right, now I'm going to test some facial sensations on you. We're going to do a sharp and a soft.
Okay.
And I'm going to show you what they feel like real quick.
Okay.
That's the soft, and that's the sharp.
Okay.
And I'm going to have you close your eyes for me and just tell me which one you feel.
Sharp.
Okay.
Sharp. Soft. Sharp. Soft. Soft. Sharp.
Okay. Facial sensation is intact. All right. And can you close your eyes for me one more time? And we're gonna do the hearing test again. Tell me which side you can hear on.
Left.
Great.
Left. Right. Left.
Great. Okay, you can open your eyes. All right. And this part is not fun, I know, but I'm going to check your gag reflex.
Okay.
Can you say ah and stick out your tongue? Gag reflex is intact. All right, and open your mouth one more time. And this is looking good. And can you push your tongue against my hand? Great. Great. Tongue strength is intact. All right, I know this shoulder is a little bit sore, but I want you to do your best and shrug your shoulders as much as you can. And if it hurts too much on that side, don't, and you can just do it on the left. Okay. Left shoulder strength is strong and weakened on the right side. Rocken, can you take a sip of that water for me?
Sure.
Swallow reflex is looking good. Can you stick out your tongue and point it up and down to the sides? Great. And can you raise your eyebrows for me? Great. And smile. Frown. Great. And can you press against me on both sides? Okay, great. And same thing with your foot. Press. Okay, and pull. Alright. Strength is intact and upper and lower extremities seem to be symmetrical. Alright, and can you stand up? And can you take a walk over there and walk back for me? Alright, gait is intact. Okay, now can you put your feet together? Great, and put your arms out for me, like that, and then close your eyes.
Oh,
It's okay, you get a little dizzy?
a little dizzy, yeah.
Okay, alright, take a seat. Have you get back up for just one more test. And stand up again with your arms out. And I'm going to have, and I know that one's hurting, so it's okay. Take your left index finger and place it to your nose. Okay? And same with the right. Okay. We're going to do a test and see how your sensory sensation is. So if you can close your eyes for me and I'm going to ask you to tell me if you feel sharp or soft sensation. We're going to start with your upper extremities, okay?
Okay. Sharp. Soft. Soft. Sharp. Soft.
And I'm going to keep your eyes closed, please, and I'm going to draw a number in your hand and tell me which number I draw.
4.
Great. And keep your eyes closed. We're going to do the same thing now on your legs.
Sharp. Sharp. Soft. Sharp. Sharp. Soft.
All right, Rockin', I'm going to test some of your reflexes, so just stay relaxed for me.
Okay.
And test your brachial reflex first. Okay, I'm going to move your arm, I'm going to do your tricep. And I know this side is a little bit painful, so be careful. Okay. And your brachioradialis. Okay, and now I'm going to test your patellar and your Achilles, and hold your hands like that for me. Great. Okay, I'm going to check your plantar. Great. Reflexes were intact.
Okay.